Welcome to my channel. I am Dr. Shikha Misra. Today we will learn about anatomy of pituitary gland. Pituitary gland, which is also called as hypophysis cerebri, is a pea-sized endocrine gland. It is located at the base of the brain at the sella turcica of the sphenoid bone. It is oval in shape and the capsule of the pituitary gland is adherent to this hypophysis fossa, so there is no CSF present in the around the pituitary gland. It weighs about 500 milligram. Pituitary gland is divided into two parts, adenohypophysis and neurohypophysis. The adenohypophysis is further divided into three parts, anterior lobe or pars anterior or pars distalis, also called as pars glandularis. It is the largest part of the gland. The second part is the intermediate lobe or the pars intermedia. It is a thin stripe separated from the anterior lobe by the interglandular cleft. This cleft is the remnant of the Rathke's pouch. On microscope, there is a presence of colloid vesicles, and this intermediate lobe is very less developed in the human being. The third part, pars tuberalis or tuberal lobe, it is the upward extension of the anterior lobe and it surrounds the pituitary stalk. Now neurohypophysis, it is also called as on neurohypophysis, the three parts of it is our posterior lobe or the neural lobe, sometimes called as pars posterior. It is smaller in size than the anterior lobe. Infundibular stem, it is the neural connection between the posterior lobe with the hypothalamus. And the median eminence, it is the part of hypothalamus present at the base of the brain near the third ventricle. It serves as a connection between the neural and the endocrinal system. The relation of the pituitary glands are very important as there are many crucial structures surrounding it. Above the pituitary gland, there is a presence of the diaphragma sella. This is the dura mater which protects the pituitary gland below it. The optic chiasma is a small X-shaped structure which is present above where the optic nerves cross each other. The tuber cinerum is the part of hypothalamus forming its floor and is present between the mammillary body and the optic chiasma. This is the infundibular recess present in the third ventricle. Inferiorly, the hypophyseal fossa is present. It is a hollow indentation in the body of sphenoid bone where the gland itself is residing. There are two sphenoidal air sinuses in the body of sphenoid bone. These are irregular venous channels between the meninges and the endosteal layer of dura mater. And on the lateral side, there is a presence of cavernous sinus along with its content. On lateral side of the sinus, there is oculomotor nerve, trochlear nerve, ophthalmic and maxillary division of the trigeminal nerve, internal carotid artery with the sympathetic plexus around it, and the abducens nerve behind it. The blood supply of the pituitary gland is supplied by this superior hypophyseal and the inferior hypophyseal artery. The both are coming from the branches of the internal carotid artery. The venous drainage, these short veins, they emerges on the surface of the gland and drain into the neighboring dural venous sinuses, that is the cavernous and intercavernous sinuses. In this picture, the superior hypophyseal artery gives branches to the median eminence and the upper infundibulum, and also to the lower infundibulum via this long artery called trabecular artery. The inferior hypophyseal artery divides into medial and the lateral branch, which forms the arterial ring, and then anastomosis with the branches of superior hypophyseal artery. The anterior lobe is exclusively supplied by this long and the short portal vessels, that is by the superior hypophyseal artery. The connection between the pituitary gland and hypothalamus is different anatomically and physiologically. The first one is hypothalamo-hypophyseal portal system. The portal system means transport of blood between the two set of capillary network, but is different from the portal system of GI tract, where all the nutrient is carried by the portal vein. However, these vessels carry different hypothalamic hormone which are releasing and inhibitory in nature, produced in the cells of tuberoid and infundibular nuclei, and are transported to the median eminence along the tubero-infundibular tract. From here, these hormones are carried by hypothalamo-hypophyseal portal system to the secretory cells of anterior lobe. The second one is hypothalamo-hypophyseal tract, which is neural connection between the hypothalamus and posterior pituitary. The hormone vasopressin and oxytocin are synthesized in the nerve cells of supraoptic and paraventricular nuclei and are then transported to the posterior pituitary by this exoplasmic flow, which is purely neuronal in connection. Pituitary gland is developed from the two sources. The adenohypophysis is developed as an upward growth of the Rathke's pouch from the surface ectoderm of the roof of stomodium, which is the primitive mouth. The posterior lobe is developed from the neuroectoderm as a downward growth from the cavity of diencephalon. The distal end forms the solid mass, whereas the proximal part persists as the infundibular stem, where the third ventricle recess is present. On the histology of this pituitary gland, various types of cells are present in the pars anterior and pars intermedia. Those who take stains are the chromophil cells, and they are 50% in distribution. And those who does not take stain are chromophobe, and they are 50% in distribution. They are non-granular and stem cells. The chromophil cells are either acidophils, that is pink in color, or basophils, that is blue in color in hematooxylin and eosin staining. The acidophil cells are somatotropes and mammotropes, whereas basophils are corticotropes, thyrotropes, and gonadotropes. In the pars intermedia, the basophils and chromophobic cells are present. They secrete melanocyte stimulating hormone MSH. Whereas in the pars posterior, we have non-myelinated nerve fibers with knob-like terminals called as herring bodies. And there are supporting cells, astrocytes, and special type of glial cell, pitucytes, are present in the pituitary gland. In this picture of the histology of pituitary gland, the gland has pars anterior, pars intermedia, and pars posterior. The anterior lobe consists of groups or cords of cells. The cells are of three types. The pink staining cells are also called as alpha cells, are acidophilic. Cells with the bluish cytoplasm are beta cells or basophilic. And the cells in which cytoplasm is not conspicuous and the nuclei are closely packed are chromophobe cells. Many sinusoids are present in between the group of cells. In the pars intermedia, colloid filled vesicles or the follicles are present. The cleft that is present here is the remnant of the Rathke's pouch. And in the pars posterior, we can see there are the nucleus of the pitucytes and the nerve fibers are present. Now we'll talk about the clinical anatomy of pituitary gland. So the first one is craniopharyngioma. It is the congenital benign tumor developed from the remnant of Rathke's pouch. It is the most common supratentorial tumor in children of age group 5 to 14. The region of the brain above the tentorium cerebelli is called as supratentorial region. The next is pituitary tumor. These are the most common tumors of pituitary gland. They can present with either general or specific symptom. The general symptom arises due to effect of the pressure on the adjacent structures. Headache, The enlargement of the gland causes stretching of the dura mater, leading to headache. Bitemporal hemianopia, where bi means two or both eye, temporal means temporal area, which is the side of the head, hemi means half, and anopia means visual field defect. So the pressure on the optic chiasma causes loss of vision in the right and left temporal field of vision, leading to bitemporal hemianopia. And exophthalmos and ophthalmoplegia are also seen, where in the exophthalmos, X means outside and ophthalmos means eye. So the pressure on the cavernous sinus causes bulging of the eyeball, outside bulging of this eyeball due to rise in intracranial pressure. And ophthalmoplegia, where ophthalmo means eye and the plegia means paralysis. So the paralysis of this extraocular muscle due to involvement of the third cranial lobe, fourth cranial lobe and the sixth cranial lobe, which is present on the lateral wall of cavernous sinuses. Now the specific symptoms are also present if there is the involvement of this cell, specific type of cell which leads to endocrinal disbalance. Elaborating more on the specific symptom, it depends on the type of cell involved. In case of acidophil adenoma, alpha cells are involved which produce gigantism before puberty and acromegaly in adult. In basophil adenoma, the beta cells are involved, causing Cushing syndrome due to excessive secretion of ACTH and is manifested by large amount of glucocorticoids in blood. The chromophobe adenoma leads to hypopituitarism, which is decreased secretion of pituitary hormones. In the lesion of the posterior lobe, produce diabetes insipidus, which presents as polyuria and polydipsia. It differs from the diabetes mellitus, where there is presence of glycosuria, that is presence of glucose in the urine. Here is the picture showing the person with gigantism. This happens due to high level of growth hormone before the end of puberty, which causes a person to grow very tall. It occurs before the closure of epiphyseal growth plate. And this is the picture showing acromegaly. Acro means extremity and megaly means enlargement. This happens due to high level of growth hormone after end of the puberty, which causes a person bone to increase in thickness. It occurs before the closure of epiphyseal growth plate. It presents very late in life, that is 4th to 5th decade of life, where there is enlargement of the feet and hands, broadening of the lower face, that is prognathism, which means protrusion of the jaw, and prominent supraorbital ridge. So this is all about the anatomy of pituitary gland. Thank you for watching. If you want more anatomy related videos, click the subscribe button and get notified.